Grief is a universal human experience, but for people with developmental disabilities, the grieving process can present unique challenges. As direct care staff, your role becomes more than just support. You are often a vital source of comfort, guidance, and clarity when someone you serve is navigating the loss of a loved one. The emotional impact of loss may be compounded by communication differences, cognitive processing challenges, or limited life experiences, making it crucial for staff to respond with sensitivity, patience, and a trauma-informed approach. One of the most important things you can offer is honest, clear information about the death. Many individuals with developmental disabilities may not understand euphemisms like passed away or gone to a better place. These phrases can be confusing or even frightening. Instead, use direct, age-appropriate, and developmentally appropriate language. For example, saying, "Your mom died," that means she can't come back, may feel blunt, but it offers clarity and minimizes misunderstanding. Check for comprehension and give the person time to ask questions, repeating information as needed in a calm and consistent way. Reactions to grief can vary widely and may not always look like what we expect. Some clients might cry or appear deeply sad, while others may become more agitated, withdrawn, or even seem indifferent. This doesn't mean they aren't grieving. It may mean they are struggling to understand or express their emotions. Others might revisit memories, ask repetitive questions, or act out behaviorally. All of these are valid forms of processing grief. Be observant and accepting of the individual's emotional expression, avoiding judgment, and maintaining a steady, compassionate presence. Supporting healthy grieving also means allowing space for rituals and remembrance. Whether or not the client attends a funeral, they can benefit from opportunities to say goodbye and honor their loved one in a way that makes sense to them. This could be as simple as looking at photos, listening to the loved one's favorite music, lighting a candle, planting a flower, or creating a small memory book. Encourage participation in memorial activities if appropriate, and help them understand what will happen in advance so they can feel more secure. Consistency in daily routine can help clients feel grounded during a time of emotional upheaval. Predictable schedules, familiar staff, and regular activities can provide a sense of safety and stability, especially when other aspects of life feel unpredictable. Be mindful of any changes in the individual's mood, behavior, or communication, and document these shifts, as they may be indicators of grief-related stress. Offering choices and allowing for some flexibility, like taking more time with meals or skipping a non-essential outing, can also be supportive. It's also important to validate the client's feelings without minimizing them. Statements like, "You must really miss your dad," or "It's okay to feel sad," help normalize the experience of grief and reassure the individual that they are not alone. Avoid phrases intended to cheer them up too quickly, such as, "At least they're not suffering anymore," which can feel dismissive or confusing. What most grieving individuals need is to be heard and acknowledged, not fixed. As caregivers, you may also feel unsure about your own emotions. It's common to grieve alongside the people you support, especially if you had a relationship with the deceased or if the client's pain is difficult to witness. Give yourself permission to feel those emotions while maintaining your role as a source of strength. If you are struggling, speak with your supervisor or seek support from your team. Processing your own emotions in a healthy way will allow you to better support others. Some clients may benefit from additional emotional support beyond what you can provide. Talk with your team about involving professionals such as a counselor, social worker, or clergy member who has experience working with people with developmental disabilities. They can offer tailored support and coping strategies that align with the individual's communication style and understanding. Group sessions or grief circles can also be meaningful, especially if multiple clients are affected by the same loss. Time and patience are essential. Grieving is not a linear process, and milestones like holidays, birthdays, or the anniversary of a death can reignite feelings of sadness or confusion. Be prepared for waves of emotion to resurface and revisit conversations about the loss when needed. Keep the lines of communication open and continue offering support long after the initial news is shared. Healing takes time, and being a steady presence throughout that journey can be one of the most powerful roles you play. Ultimately, helping someone grieve isn't about having all the answers. It's about showing up, staying present, and holding space for them in their sorrow. When you offer reassurance, clear communication, and compassionate care, you help your clients not only navigate loss, but also feel less alone in it. In doing so, you reinforce their sense of dignity, humanity, and belonging even in the hardest of times.